Thanks for tuning in to Recovery Inspired Hope. Make sure you click the subscribe button and tap the bell right here so that you can get notified every time that we put out a new video. Super excited, guys. Thanks for tuning in to Recovery Inspired Hope. I'm here at Alliance Recovery Center in Athens, and I'm about to show you the grand tour of everything that goes on here. So we are coming in. Hi.
Hi.
This is Mrs.
Oh, I'm Samantha Presley. I'm the peer support specialist here at Alliance Recovery Center.
Hey, my name is Sam and I'm a person in long-term recovery, and what that means to me is I have not used any illegal mood or mind-altering substances to change the way I feel since April the 22nd, 2016. Part of my story is I am a certified addiction recovery empowerment specialist, CARES, and I'm also a peer support specialist in addictive diseases, and I'm also a peer support specialist here at Alliance Recovery Center. What my recovery has afforded me today is I get to be a mother today to my 16-year-old daughter. I also get to be a great daughter to my own mother. I'm capable of making health decisions for her today, as well as I get to support and advocate for my community. I absolutely love my recovery community. I love my network. They are what keeps me connected and grounded, and because of that, I'm able to live my recovery out loud.
Alright, so as on Tuesdays and Wednesdays we do intakes here from 6 to 9, and as a new patient, new peer, what you would do is you would come up here to Miss Cynthia and you would get a new patient packet along with a book, and then we would start your process from this point here. Okay, and so once you get your new your intake packet, you would sit down and you would fill this out, and I would come out and I would introduce myself as the peer support specialist. And so you would fill this paperwork out. We would figure out exactly how it is that we could best help you here at Alliance. This is more like treatment with a side of medication, and it really shows through the work that we do here.
Hi, I'm Jessica and I'm the Director of Nursing for Alliance Recovery Center. So kind of how the process works: after you see the doctor, you will come over here to be medicated. We kind of discuss with you what medication you're on, some possible side effects that you could have following medicating today, and kind of what to expect going forward, what your order is, so if you're eligible to go up every other day on your dose, and just to let us know following your intake dose kind of how you're feeling the next day, how the medication made you feel, and we kind of go from there.
My name's Jamietall, and I'm the program director here at Alliance Recovery Center. What I like about working at Alliance is that we offer a harm reduction approach to treatment, which I think is a good thing to have in a community, so that people have a different flavor of addiction treatment. So what I mean by that is we offer medication, treatment, other harm reduction services that can be like syringe exchange, naloxone, anything to help them use safely. I really love that we meet the client where they are in their recovery.
So yeah, we also have pipes or whatever you may need depending on whatever substance it is that that you're needing supplies for. We also have a sex worker kit, which consists of pepper spray, Plan B, condoms, lube, Clorox wipes, female condoms, male condoms, and then we also have chapstick in there. And so basically the peers will just say, hey, I need one of these kits. We come down, we give them a kit, and then of course we also have Narcan, and any of our peers can get this at any time, and they just come down, and as you can see, we keep all our supplies here, and then we just restock them each month. And next, from the counselor, you'll come and see our doctor, where our doctor will see exactly what it is that best fits you here at Alliance.
Hello, my name is Donald Burris, and I'm a therapist here at Alliance Recovery Center in Athens. And what I love most about my job is the collaboration with all of the counselors and therapists that are here. But most importantly, we certainly love to take care of our clients as they are trying to get their recovery together. So I thank you for this opportunity. Thank you.
Hi, my name is Millie. I love working here because I am 5 years sober and I really enjoy helping other people with the same problems that I had. I believe in recovery and yeah, that's about it.
Hi, my name is Bridget Muckle. I'm a counselor here at Alliance Recovery Center. The best part about working here for me is, first off, my coworkers. I've been working here for about 6 months now, and they were just so warm and welcoming to me when I got here, and that also translates to working with the clients. So my favorite part about working with the clients is just getting to know them better, because we meet with them weekly starting off. So just getting to know their story and the best ways that I can help assist them in their recovery journey.
Hi, my name's Eva Masalik, and I'm a LMSW here at Alliance Recovery Center. One of my favorite things about Alliance is that we provide clients with life-saving medications, and I get to meet people where they're at.
In June of 2016, I actually come to Athens, Georgia in the back of a police car with pink handcuffs to a sober living facility called Freedom from Bondage, where I stayed there for over 12 months. And when I got to Athens, I didn't have anything. I was actually homeless when I got locked up. And so when I got here, I had no more than one pair of pants, a tank top, a pair of flip-flops, and that was pretty much it, and a bag of jail belongings that consisted of state-issued items like soap, shampoo, conditioner, and things like that. I was mandated by a judge to get here. One of the things that the judge said to me is, suspended upon you do not complete your sober living facility in 12 months, you will go to prison for 4 years. My sentence was actually going to be 10, and he would see to it that I'd done 4. Got to Freedom from Bondage and started, that's really where my recovery journey began, and I had lost everything. And from that, I was working from, pretty much, I call it the gift of desperation is what it was given to me. And I started here and I started working my way up. I had lost my license. Like I said, I was homeless, had lost my child. I didn't really have anything. So I started setting some goals for myself, and I set a 5-year goal plan. The first thing was to get a job, to get my license, to get a vehicle, to get a home, and then get my daughter back. And within 5 years, I was able to obtain all those things. But I had to start small and make little steps in order to do so. And like I said, today I sit in front of you, and I absolutely love what I do for a living. I'm a peer support specialist, and I get to make connections with people in my community, and I love it. I love people. And I love helping people, and I love seeing people do well. That's just part of what I love doing. And, one of my biggest reason why is my daughter Lillian. She's 16 years old. She is the biggest blessing. And me and her, pre-COVID, we used to go into sober living facilities and talk about things like what it's like. She would talk about things like what it's like to be the daughter of a person in recovery, because as we know, this is a family disease and it affects all of us. So, and she's my reason why. And my purpose is, once again, I get to be there for my community and support them and meet them where they're at.
So I've officially gotten the whole tour and got to meet all of the staff here at Alliance Recovery Centers. And I'm really just blown away by the amount of support and how the actual process of this is laid out so detailed to help any kind of person with any specific need. Everything can be met right here in this building.
Yes, absolutely. And we've also reached out to the peers here to find out how we could even better support them. And in late August, we'll be opening up another ARC for evening clinic. And I believe the name of it may be ARC PM, but the hours will be 11:30 to 6:30. I believe with the clinic opening at 12 and staying open until 6 p.m.
Wow.
Yeah.
Because here you have to come super early in the morning, right?
Yeah.
And that's not always...
Correct. Yeah. So right now, if you come, it would be from 6 to 11. We're actually open until, we're here until 1, but we close at 11. So
let's talk about some things like, what is the purpose of a person coming on medication assisted treatment?
So when a new peer comes in, one of the first things is that I ask them is like, what brings you here to Alliance? And one of the things that they would say, and I'm going to get really raw here, is, I'm coming off of heroin, and I've been using heroin for maybe anywhere from a year to, 30 plus years. And then the next question is, and it's going to get really personal, like, how do you use that? And so someone who's coming off of opiates or heroin, and they're looking to start improving their life.
And so medication assisted treatment is
Correct.
specifically for people coming off of
Heroin and opiates.
Okay. Yeah, because I came off of Roxy's and pain pills. And tell me how, like, because I love what you said earlier about this place is recovery with a little side of medication.
Correct.
Tell me about this.
Okay, so one of the things that when I got here that blew my mind, that I absolutely loved about this particular facility, is when a peer comes in, they get a counselor assigned to them, and this counselor starts this treatment plan, and this treatment plan consists of figuring out what best fits that particular peer. So they start making goals for themselves, and they start creating these goals and achieving these goals, and then we work off of that. And then once they meet with the counselor, of course, they go and they get their medication. And then what the beautiful thing is when you start seeing things progress, and then as the peer support specialist here at Alliance, the peers come and they see me, and we also set up some goals. So one of the things that I do is on a scale from 1 to 10, where are you at? What resources are you needing that we can possibly help with? A few of the things that we've done for the peers within the community that come here to Alliance is we've been able to help a peer go to the eye doctor for the very first time. We've gotten peer dental work, and that,
Awesome.
That part, we've gotten like surgeries for peers. We help with housing. We have these grants, transportation. We do gas cards. Once a peer starts doing their treatment plan and things start falling in line, we help them in other areas of their life, not just about coming here and being able to get their medication that they need, but also in other areas. And that's what's so beautiful to me. And like I said, it's got so much unity in this building. And I'm not sure if you could feel that when you walked in, but
Absolutely.
I love
Absolutely.
it. Yeah.
So let's touch on something that I always hear, right? So with our background, we are trained and came up in this whole multiple pathways to recovery, right?
Yeah.
So tell me, what do we tell someone who says, I know I'm on heroin, I know I'm, using it in a needle, I know I need to get off of it, but I don't want to be on medication because then I won't be clean.
Yeah, that is absolutely incorrect. So one of the things, and we do have, I have peers that sit down and they feel the stigma and the shame of being on M.A.T. And so this is one of the things that I explained to that peer. It is no different than needing diabetic medication, and I'm gonna give you an example. So you have different types of diabetes. You have type 1 and you have type 2. I believe, if I'm not mistaken, type 2 is one that you occur over time. You're not born with it.
Right.
That's the same way with your addiction. So when we start our recovery journey, no one starts off as wanting to be an addict. No, I don't know a single person that's ever said, when I grew grow up, I want to be an addict. That's not anything that, right. And so, the same way that someone may need the diabetic medication to help them with their diabetes and control their blood sugar, it's the same thing here. You need these things. You need this medication. You may need the medication. You may not. That's what our doctors figure out here, because there have been patients and peers that's come through, and this isn't the type of pathway that they needed. But there's also patients that come through and this is exactly what they needed to be successful.
Exactly. That's why we have doctors here. That's why we have counselors here. That's why we have nurses here.
Correct.
Because you can't diagnose your own diabetes and cancer, right? But a doctor can tell you, hey, this is what you have and this is what can help you.
Correct.
Right.
Yeah. Exactly. And so, and like I said, that's when the part when we talk about this is treatment with the side of medication, because not only do you walk through these doors and get your medication, you get a counselor, you see a doctor, you talk to a nurse daily, and you get to tell every one of these people that you come in contact with, and you get a peer support specialist where you're at, how you're feeling. Do you still have cravings? What can we do to best fit this plan for you that's going to make you the most successful that you can be?
Right. Right. So. That is amazing. I just wanted to throw that out there to stomp out that stigma.
Yeah, absolutely.
I know people are going to be watching this, and so there's your answer.
Yeah, right. Yeah, absolutely. So, and like I said, one of the beautiful things about this facility is that we get to watch peers progress. I get to see, and I love my job. I see this TikTok and I love it because it's like, hey, I'm on vacation every single day because I love my occupation. I love my job. Like, I absolutely love that I get to see the peers. They walk in and they're like, hey, Sam, like, and I get to form these relationships and make these bonds, and then to start seeing their progress. It's like, yay. And then, not everybody, sometimes, some people move quickly, some people don't, and that's okay. Like, we get to meet them where they're at, and it doesn't matter where they're at. Everyone gets the same amount of support, and so, and that's the beauty of my job. And one thing that I believe it was Bridget said, like, the unity between the my coworkers here and the director and Brooke, who is the founder, and his brother John. It is absolutely phenomenal, the support that they also give. And so, and because you get that from them, it shows through your work, and it is beautiful. I love it here. I absolutely love my job.
Awesome. Well, thank you so much, Sam. Thanks for giving me the tour. Thanks for educating us and bringing awareness about this. And hopefully somebody out here will hear this and know where they can come so that they can be met exactly where they're at to get the recovery that they need.
Thank you, Jamie, and thank you for everything that you do for our recovery community, because you are a champion. Yeah.
My girl right here. Bye, guys. We'll see you next time on Recovery Inspired Hope.